The number of suspected Ebola cases in Central Africa has dropped by hundreds as testing for the virus improves. And as global health agencies respond, questions being raised about the U.S. role in the fight. Bradley Blackburn with the latest.
Days after visiting an Ebola treatment center in the Democratic Republic of Congo, the head of the World Health Organization tells CBS News he sees glimmers of hope.
5 people actually recovered from Ebola. That if people get the right medical support, they can recover.
But he acknowledges the virus had a significant head start and challenges remain.
The community mistrust is very, very serious, and that makes the response actually complex. But we're trying to change the tide.
No approved vaccine exists for this deadly strain, and the International Medical Corps says 20% of new cases are in healthcare workers. Secretary of State Marco Rubio told Congress the Trump administration may appoint one official to oversee the U.S. response.
I don't want to use the term Ebola czar.
And he defended the U.S. reaction to the outbreak amid cuts to public health.
Well over $200 million to partners in this response. This is not a scramble. This is something that broke out in a rural area of a war-torn country and was underreported for over a month.
CBS News medical correspondent Dr. Celine Gounder worked in West Africa during the Ebola crisis a dozen years ago.
I think the U.S. funding cuts certainly contributed to the late understanding of the current situation and is part of the reason why we're so behind in responding now.
The WHO emphasizes that Ebola is not currently a threat to the rest of the world. Bradley Blackburn, CBS News, New York.